So first of all, thank you very much, and really delighted to be here this afternoon, listening to some fantastic work going on across healthcare services. And I'm afraid you're going to be bombarded a little bit more about neonatal care. Really good presentation from Rebecca earlier, and we are part of the network that works closely with our ODN colleagues. So this is around our Keep Me Close accommodation for our neonatal families, both local and regional. And I'm Katie Hoffman, NICU Senior Sister, and this has been a project that I've worked very closely with Tracy Stacey, our NICU and Keep Me Close fundraiser, and Roisin McEwen-Carter, our NICU nurse consultant. So basically, let me give you a little bit of background about the Plymouth NICU story so far. So we were a designated level 3 tertiary NICU back in 2005. That means we are caring for the sickest and smallest babies from across the Devon and Cornwall Peninsula, working closely with our colleagues from the Exeter and Truro local neonatal units and our Torbay and Barnstable colleagues who are the special care units. On average, we provide about 1,800 intensive care days per year. And University Hospital Plymouth also hosts the transport service, which is responsible for the retrieval, referral and repatriation of neonates into and out of Plymouth NICU. The neonatal unit was built pre-designation back in 1992. It was a state-of-the-art facility for the local neonatal population at that time. And within that footprint, it created a family area of 4 bedrooms to facilitate some opportunities for Plymouth families to stay, especially where end-of-life palliative care was concerned or in preparation for discharge. The length of stay for NICU families, I know Rebecca mentioned this, is varying, very varying depending on gestation and their clinical needs. But for an example, where a baby's been born 16 weeks early, we can expect a family to be resident at least for 16 weeks on our unit, and a sick term infant at least 2 weeks. Wherever possible, families would be accommodated in one of the NICU bedrooms, and facilities, however, were suboptimal. There was no laundry provisions, 1 shower and 1 small kitchenette, microwave, kettle and toaster for all the families to share. It was far from ideal and below the expected standard we wished to be able to deliver. And then in 2013, there were 2 significant changes. First of all, we had the neonatal service specification and the operational delivery network. So the neonatal service service specification provided an expected work plan and key performance indicators for each level of neonatal unit. It included minimal levels of workforce, education, access to allied health services, and around parental facilities and the support mechanisms that they were entitled to or should be expected to be received. The networks amalgamated here in the Western and Peninsula, became a Southwest ODN, and with further centralisation of neonatal care, we saw an increase of collaboration with our maternity colleagues and increased intensive care acuity across the NICUs. And then here at UHP, there were some significant changes in the NICU senior nursing leadership. We had a new service line clinical director who was a very experienced neonatal nurse, Roisin McEwen-Carter, and myself and as ward manager in post. We wanted to reinforce and promote the service specification ethos of keeping baby and family at the centre of our service and the care that we delivered. And this included never asking a displaced family to go home. And it became apparent that our promise created challenges, as not only were the 4 bedrooms not enough to support our regional or local families, but our facilities were far from ideal. Bliss also presented some really interesting reports. Bliss is the charity for babies born premature or sick, and I've actually had some quite influential, influenced some significant changes around some of the care and how we deliver care across neonatal units across the country. And one of the reports, which was called Keeping Families Kept Apart, it summarised that 1 in 7 neonatal units told us they were unable to provide any or early or only very limited facilities or financial support to families. 40% of neonatal units have very or no limited kitchen facilities. Fewer than 1 in 5 NICUs have enough overnight rooms for parents of critically ill babies. And 1/3 of hospitals now charge parents for parking when they could previously park for free. And 1/3 of hospitals can't help parents with food and drink costs. And so despite our successes, our families' experience is still challenged. But one of the things that we could do is that Here at Plymouth NICU, we were able to provide and arrange a £50 bursary. That's included in our commissioning to all our displaced families. It's non-means tested, and that goes to each of our families, and it's up to them how they spend it, whether it's around transport costs or some additional food costs. Our kitchen facilities remain unchallenged and unchanged due to the footprint of the neonatal unit. We only have the 4 bedrooms. We're now down to 3. One of them we tried to reserve for our parents of end of life. We've managed to secure some all families on NICU free parking, so we've been really pleased in achieving that. And also, we are NICU families, each parent gets a meal voucher a day, and that's for them up to the value of £5, which they can utilise in any of the restaurant facilities. Is that the ethos from myself and the SLCD was very clear, however, that we really didn't want our NICU families, any displaced family, to go home. So there was some hospital approved accommodation nearby. So when we had to ask a family to vacate a room on the neonatal unit, we would provide accommodation at the expense of the trust. And that worked out about £75 a night. And I know that our bill went up to about £20,000 in 1 year whilst we were trying to accommodate families so that they didn't have to go home. And I guess what we really need to understand and make very clear is why we want our families to stay. So we know that so this is Tracy, who's the NICU fundraiser, and here she is with Phoebe. And this is Phoebe. She was born at 23 plus 6 weeks, 490 grams here at Plymouth Neonatal Unit about 22 years ago. And here she's Phoebe now, lovely and gorgeous, and one of our neonatal technical support workers. And Tracy has been really keen to try and take our message through about why it's so important. We know that a lot of our families, Bliss have also echoed this, as well as lots of other work, that our parents suffer. We have to promote the bonding, any opportunity to bond. So that's more than just our visiting, but creating skin-to-skin opportunities, being able to undertake cares, being involved in ward rounds and decision-making with their babies. It's also about ensuring that by enabling them to stay, we also reduced any kind of exacerbation of parental mental health issues. And we also know there's some increasing evidence about post-traumatic stress with our NICU families if we don't provide provide the necessary support that we can. Plymouth have also been able to secure a clinical psychologist to support and work very closely with our families whilst their baby's an inpatient here at Plymouth NICU. So our desire to improve those facilities and a desire to ensure our parents could stay, we utilised Tracy, as I say, an ex-NICU mum who is extremely passionate about neonatal care and her journey that made her the right person for the right job. Sadly, there was no financial solutions which could be found within the trust. So capital funding wasn't an option. So it's agreed that our charity pill was the only solution. So the Keep Me Close appeal was born. The appeal, and that was came from a set of parents whose baby son George was born at 23 plus 4 weeks and was weighing only 650 grams. And sadly, George passed away after 15 days. And his parents talk still now about how forever grateful they were for being able to stay on NICU, and it meant they did not miss a moment of quality time with their son. So we're very proud to be able to keep continuing using their name going forward. Our original aim was to raise £2 million to have a purpose-built facility for our parents and families to provide a home from home experience. But kind of going forward, the fundraising was extremely successful. In about 3.5 years, Tracy, with the support of families, and what I want to say is families want to give back, and I'm sure that a lot of people will have had that experience, but the NICU families just want to be able to find a way of giving back, and this is what they really wanted to do. And so they were really engaging. We have a very proactive Facebook group page where we've got about 1,500 members now. So we had raffles, we've had balls, we've had incubator pushes from the centre of Plymouth up to Derriford, we've had skydiving, and throughout that time we've managed to raise £350,000 in 3.5 years. £2 million, that was our dream, but it wasn't going to be a realisation. We were challenged around that, and we were told to think outside the box. And then we did think outside the box, and we looked to see what was around, to see if there was any kind of houses, etc., that we could utilise. And what we found was some student accommodation that was nearby. It provided us with 7 bedrooms, all en suite, with a fully functioning kitchen, laundry facilities, and a sitting room. However, there were legalities. Our initial aim to arrange the 2 million wasn't quite the aim that we're using now, so we had to use external legal advice from an expert team in London. We had to get permission from previous donors to ask them if it was okay to utilise the money, because the money wasn't going to, it was going to be used as rent basically, and we had to get their permission about that. And that took some time. It took us about 3 or 4 months to kind of get that through and finally approved. We also had the landlord of the student accommodation have to get planning permission because it wasn't a residential facility, and he managed to get residential approval for the 7 bedrooms in the one flat. And again, that contributed some time in getting that approved. There we go, planning permission. Very quickly, we are now able to provide 7 bedrooms, fully furnished at no extra cost to families. Since November last year, we have provided 622 nights to 22 families. The longest length of stay has been 143 nights, and it costs on average about £27 a night, which works out about 70k a year to run. But it's been an absolute godsend for our families. Thank you.